Mm. All right. It's a very, very good evening, Nimbula Vinaka. Warm Pacific greetings to all our wonderful listeners who are joining us this evening on another very wonderful topic that we've started a couple of weeks ago, and we're continuing this series on women's health. And today there will be a focus on women's health care in Australia. And we are just so blessed to have the presence of these two amazing medical doctors, Dr. Fabian Ring and Dr. Tema Rasoki Windust. Both of them have been part of my Talano series, and it's just been amazing with all the feedback that we've been getting from our sisters, our aunties, our mothers and grandmothers and daughters and nieces. And it's just wonderful that we've created this wonderful platform, to talk about topics associated with women's health. And again, many of you know, and we all understand that many times the topics that we discuss are, very sensitive. However, with the presence of, our medical doctors, they're able to translate, some of those medical terminologies, in very layman's terms so that we can be able to understand, and it can help us too with our decision making. So, we have about 30 minutes. That's our plan for today, because I know that most of you are very busy and you all have, your families to look after, and most of you just coming back from work. And I would also like to call upon our sisters and our women who are part of the PAM scheme in Australia to also join in and listen in to Dr. Fabian and Dr. Tema, in which they will be able to share with all of us, the healthcare system in Australia, how it can be explained in very simple terminologies, and also looking at, what you can access through Medicare, through private health insurance, and how you can make the best choices for your health and for your family. So now I will pass it over to our two amazing guests, Dr. Tema and Dr. Fabian. Vinaka vakalevu, and welcome to this Talano session.
Thanks, Dr. T. So I might start then, Tema, if you don't mind. I think it's just an absolute pleasure to be here with yourself, Dr. T, and Dr. Tema. I think it's a really good topic, and it's great that we're talking about it because it can be really confusing for us as doctors. I think, let alone the women that are out there trying to access these care models. So I think it'd be nice to, like you said, let's simplify it and break it down tonight, and just maybe have a few key points that we can take away.
Vinaka vakalevu, Dr. Fabian, Dr. Tema, would you like to
Yeah,
say
Vinaka.
opening statement?
Yeah, Bulbinaka to all the listeners. Thank you for listening in tonight. Vinaka Dr. T for giving us this platform to sit and discuss with you, with the rest of not just the Fiji women, but also the Pacifica women, their families, giving them a really deep understanding of what the healthcare system here in Australia is like. And as you know already, for those women who come in to Australia or even New Zealand for the first time, it's very hard to navigate the healthcare system, know how to go and see a doctor, how to go and see a nurse. It's a very different setup from what we have in Fiji or in the rest of the Pacific. And so this platform is really important for us to be able to open up the dialogue where we can sit and discuss, and also give some proper advice from us in the healthcare department that's working firsthand to advise our women where they should seek help, when to seek help, and what are some of the processes that is available for each of these women coming in. Naka. Mhm.
Vinaka. Vinaka vakalevu sana, Dr. Tema, and Vinaka, Dr. Fabian. Now, for the first segment of our Talanoa, we'll be looking at accessing healthcare in Australia. So, many of our women moving from Fiji and from other Pacific islands, to Australia. And, we see that the Australia's healthcare system, can be very unfamiliar to many of them. Now, can you both walk us through what the public system looks like?
Thank you, Dr. T. I will start by just educating the public as well as our listeners. For those who are not familiar with what the Pacific system is like, before we move on to the Australian system, just to give a contextual background. In terms of the Pacific, say, for example, in Fiji, if anyone is unwell, you go up to your local doctor, and it's usually your local hospital or your local healthcare. It's free. You don't need a booking. You walk into what we call an emergency department, which is, very little things like cuts and bruise and or a sore ear, or things that in Australia they would normally go and see their GP for. And there they can sit there for hours. You will have 100 or women or people waiting generally to be seen by a doctor. So equivalently for the antenatal care for women that are pregnant in Fiji, they will turn up to the antenatal clinic in numbers. So there will be 100 women waiting outside the antenatal care.
Wow.
In the main tertiary hospitals, for example, Lautoka, CWM, or Suva, or Lambasa. And in that process, they will be waiting for a specialist to see them for normal routine or low risk antenatal care. And sometimes, if there are some complicating factors, obviously they spend more time with the specialist, but they all come in big numbers. They all wait outside, hundreds of them. It's free. They get to see there's no such thing as a GP visit. They see the specialist, they get their plan, and then they go home, and then they get their card again to come back for another visit. And because of the volume of the women that are being seen, the visits are cut really short. And they're cut to, for a standard visit here, for example, that's 45 minutes long per session, that would be reduced to maybe a 5-minute consult. And so as such, you can understand these visits are all condensed into a very short time frame with missed opportunities for a lot of one-to-one interaction or care. And so in this process, the women that finally take the step or the leap to come across to countries like Australia, New Zealand, it is a shock to them for the system, because you cannot walk into a tertiary center or a hospital to see a specialist right away for something that small. So with that opening statement, I'm going to pass over this discussion to Fabian, just to give a highlight on what is the normal process for a antenatal care visit here in Australia.
Thanks, Dr. Tema. I think it's a little bit different, as you suggest, in Australia. So usually most people would have potentially a local doctor or a GP that they would know, usually beforehand, sometimes not. And they might, in an antenatal setting, so they might do a home pregnancy test and then book to see with their local doctor to start the initial scans and tests. It's for any of our listeners from Queensland, that's actually changing a little bit from the middle of this year. So Medicare in Queensland is actually getting a lot of our women to the ability to actually present to the hospital if they need to. So I do want to highlight that is changing. So for women that find it hard to see a GP in Queensland, or don't have a regular doctor, or feel that they can't get to someone in time, in Queensland you can, from July, from the middle of the year, in a month's time, you can actually apply straight to the hospital. But generally speaking, let's say that you would see your GP first to get those first tests and scans. In Australia, we've got a system called Medicare, and so that usually helps to put some funding or some money towards those first visits. Sometimes there might be a little gap payment with doctors in Australia, and sometimes that would be fully covered by the system. The workup generally would be, as Tema said, some of the first appointments might actually be 15 minutes to 40 minutes or more if we feel that they need to be explored more, if there have been maybe some previous complications with the pregnancies, or if we feel just that the mother or the family have more questions that need exploring. And so I think the good thing in Australia is we might try and create this extended consult first to make sure that we've got all the information, because we know that it can be quite complex sometimes in pregnancy, and we do want to support all aspects of the pregnancy. So I think that's the first thing. In Australia, there is Medicare, and then under Medicare, there's your GPs, but we also are trying to make it more inclusive and easy to present to hospital now in Queensland from the middle of the year. If you're an Australian citizen, a permanent resident, or have certain visas, you actually are eligible for Medicare, and so you are eligible to get some of that money back as well.
Thank you, Fabian. So, Fabian, just to clarify for the viewers, when they do turn up to the GP, say, for example, they've got a Medicare card.
Sure.
So, in the context of women that are coming in from Fiji, for example, if they come in on a visitor visa, or they're coming in to visit families, or they're coming in on a business visa, or they're coming in for the palm coin strategy, which is one of the labor scheme pathways where they are recruited to come in and work for various organizations here in Australia. And as such, their healthcare has some sort of coverage. So if we separate the two and say, for example, those with Medicare only, when they turn up, are they expected to be paying upfront the fees of the GP care visit for their first antenatal clinic? Or if they have a Medicare card, that is exempted and they are not expected to pay. Can you please elaborate a little bit on that, just from a viewer's perspective?
There's two versions. So one version would be that you have an exclusively bulk billing doctor, which means that there's nothing to pay if they have their Medicare card. If the doctor charges a gap payment, then you would pay, let's say if it's $70, you would pay the $70 and then get the $40 back from Medicare. So you might pay out of pocket $30 for that visit. But the way that it works is you actually have to pay for the whole amount first and then get the majority back. And I think that's an important thing to know when you're going in, because the clinic might have said to you, oh, well, it's only $20 or $50 out of pocket. But that might be after the refund. So I think that is important to know, opposed to a doctor that might be in a different clinic that might bulk bill all their visits. That means you wouldn't need to pay anything out of pocket. In Australia, it's generally mixed billing, and so it's generally the first scenario.
Sure. And so if, say, for example, on the flip side of the coin, they are on some form of private health insurance. Before they leave the country, they are already on a set private insurance company that exempts them or allows them to get into the country for that reason.
Sure.
So when they do turn up into the GP practice, do they still have to pay out of pocket and claim that money back from their private insurance provider, or how does that work?
A really good example is Bupa is one of the biggest private medical companies that would sponsor a lot of people coming in. And I mean, that's just one version. But yes, they pay up front and then they get the funding back when they submit it to their private health insurance. Again, if the doctor, sometimes, for example, if I'm in a clinic and I feel like I'd like to bulk bill that appointment so they don't pay out of pocket, they still will pay, let's say, the fee, the bulk billed amount. So let's say it's $80. They would pay that, but then if I've matched what the value of that, they should get all of that back. So I think the takeaway would be that it's very dependent on the clinic, but usually it's a form of mixed billing. And usually a lot of GPs will do a bulk billed follow-up, not necessarily the first one, so for results. So it can be really tricky, and there's no standard model.
Yeah. Sure. No, thank you, Fabian, because this is really important for someone who is foreign to the country, navigating the processes. That's one of the biggest hurdles I had to go through personally when I first arrived into an international country, maybe 11 years ago now. And understanding processes, because we are so used to, in the Pacific, walking into a healthcare system, whether you have money or not, you are still being treated, yes? And you have healthcare visit, you have a healthcare provision given to you, but here it is equally different. And one of the messages that I want to give out to our Pacific Islanders that's listening in this segment is, before you sign up on your visa, have a second look at your healthcare insurance, see what is and not covered, particularly for women in your in the private health scheme that is covered. See if it encompasses your full antenatal care package. Does it include your intrapartum care, which is your care during your delivery, and also your postpartum care, because that is really important. And with that not being provided, that drives a lot of the issues, which we're going to talk about later. Sorry, for the purposes of the listeners listening out there, when Dr. Fabian is referring to the first antenatal care visit, this is really important. First antenatal care visit here in Australia is less than 12 weeks. So that is when you find out you're first pregnant and you get all of your antenatal bloods, dating ultrasound scan, and everything done, put together so it's ready. Unfortunately, in the Pacific, one of the biggest hurdles we have is late booking. And Fabian, this is not a new thing. It's a generational thing. People know they're pregnant. They take their time with coming in to get their dating scan done, their booking. And some of them turn up at 28 weeks because they've done it many, many times before. Forgetting that when you do turn up late with your booking here in Australia, when things are picked up late, that's added bills, added money, added expense to you. If things are picked up late and they're intervening in so many ways to create a safer pregnancy, that's more expense for the person at the end of the day. So it's better to be a little bit more proactive, come in and get all your proper antenatal care done. So from the moment you find out you're pregnant, it's better to come in. And we did a study in New Zealand, in Dunedin, and it was on inequity to access in first antenatal care amongst immigrants and non-immigrant women in Dunedin. And interestingly, the results of that was amongst our immigrants, that the failure to take up the first antenatal care visit was much significant, unsurprising, which led to poorer healthcare outcomes. But that's something we can certainly, fix, hopefully with these messages.
No, thank you so much to you both for reminding us, particularly for those of you in Australia, those of you who are listening in, the importance of, reading up your visa conditions. It's really, really important. There's so many visa categories that everyone has. So do that. If you haven't done that today, make sure you do that before you go to bed. The other one too is, if you have a Medicare card, try and just read up a little bit about what is part of that package that you have. Yeah, so it's better that you know a little bit more, but also, if you're not sure, reach out to us. Then we could refer you to the best person, who can be able to combine, the visa plus the Medicare card that you have. So Vinaka vakalevu, Fabian and Dr. Tema and Dr. Fabian. Now, in terms, keeping the discussion on women's health, and also, a lot of our women who are listening in as well, we'll be thinking about, cervical screening. We've, talked a little bit about the, pregnancy care. What other services are there for our women that you want them to be aware of?
Okay. Fabian, I'll let you start from a GP perspective, and I can build from there. Mm-hmm.
So the cervical, we've got a program in Australia where we will screen all women from reproductive ages of about 25 to 74. And as part of that, there's also something that happens before that, and that's we offer a vaccine, which is called Gardasil, and this helps to prevent, I guess, the severity of this screening program where we go looking for a virus, and the virus is called HPV, or the human papilloma virus. So in Australia, I guess the program is aiming to try and minimize women that may have this virus and may get rid of it and then may contract it again, but then have it in their system at the cervix for a number of years, which then places that woman at a risk of changes to those cells in the cervix that then can go and down the line potentially lead to things like cancer and other changes at the cervix. So in Australia, we if you've had if you come into the GP and you're 25 and you're getting your first pap smear, we would do that. If it's normal and we don't find any changes in any HPV virus, then we would say that we'd see you in 5 years for another pap smear, unless you've got changes like, and this is where we would ask those personal questions. So is there irregular bleeding in between your cycles? Is there bleeding with intercourse, with sex? Is there particular pain with sex? And this is where we might discuss with our colleagues like Dr. Tema, do we need to do things more urgently? And that's when we would do an earlier pap smear than the 5 years. I think one other thing that's been quite good recently in general practice is that we're encouraging actually self-collection testing. So let's say you go to your GP or don't have a GP, but you've heard about this cervical screening and you'd like to get checked, and you've never been checked before, or you've only been checked once before, but you're not too comfortable with your doctor checking, your private woman's parts and checking your cervix. In Australia, we've got a program where we can give you everything in the GP clinics or in the hospitals, and you can do your own pap smear in the privacy of the bathroom or a room, and we can walk you through and tell you how to do that, but not be in the room. And I think that's a really nice way of providing a bit of dignity and privacy if women don't want to do that themselves.
And thank you, Fabian. That's a really important point about self-collection, which we are trying to advocate more and more. And I find, particularly women of various backgrounds and cultures, particularly ours, they tend to see, I find that is the biggest uptake of form of cervical smear screening. Now, with what Fabian's talking about from a GP point of view, so the screening program here is every 5 years. So if you have had your screening smear done in Fiji before leaving, or the Pacific before leaving, the program in itself will not be able to pick you up if you're due for one or not, unless you've registered with your GP. So you have your own, it is in your own best interest when you do arrive into the country, or if you're visiting, to ensure that you go and book yourself with one of the GPs and to have a full medical history done, and also update them on your cervical smear screening background, because we don't have access to any of your files or information overseas. And the only way that we can do it is through your consent, apply to your previous provider and obtain your medical notes from there, whereby we can then follow it up. And particularly so for our women who are overseas and have had abnormal pap smears. So they come to see us in the specialist room. So now if I navigate the process, say you have gone to see your GP and your GP puts a referral through to see a specialist. In Australia, the beauty about Australia is you do have the option of waiting to see a specialist in the public sector, or you can go and see a specialist in the private sector. If you do have a private insurance, then your insurance covers either way. So, and often always, it is faster to go and see a specialist in the private sector because of your insurance. So check with the insurance first. And if that is the case, it is much faster to go and see a specialist. And as such, the specialist will look and perform specific procedures, checking into your cervix using a magnified microscope. We call that a colposcope. And if we find any abnormal cells, then we'll biopsy. And then we'll discuss with you about the options going forward on what you have available. The clinics here are very specialized, and it is a booking system. So if you do get a booking, please make sure that you do attend, because the bookings here are very tight and women are all in the wait line. And so, if you miss an opportunity, it is very hard to get another booking unless there is obviously some pre-underlying, what we call category 1 condition, where it has to be sorted within 30 days. You will be accelerated in the system regardless. But if it is a category 2, then you have up to 90 days and you may miss an opportunity.
No, thank you again, Dr. Tem and Dr. Fabian, for shedding light on that. When you were both speaking, I was also thinking about, women who are traveling, moving in from one country, moving in from one country into Australia. And again, there will be some women who may have been checked where they came from. If I can use me as an example, because we moved a lot back, a few years ago, but I'm still very old school. I have a folder with all my medical files in it.
Great idea.
But then there's also on the other side those who are very computer literate, who have PDF copies of their reports. What would you encourage our women to do? Because some may arrive in Australia and they may feel scared to go and see a GP, but they may have some folders and files that they brought with them. What would you say to them?
I think it's such an important topic that you brought up, because we tend to find that, in the Pacific, and I'm speaking from a Pacifica woman with upbringing from the Pacific, and having the experience of working in both a Pacific or a second world country, and then coming to a third world country. And so for me, the cultural context of going to see a doctor is always, if you're going to see a doctor, it's all about sickness. You're going to see a doctor or a GP because something is wrong. Something is not medically right in any part of your body. And so with that concept, we tend to find that when you do arrive into the working environment, the perception is that if I were to go and see my GP, I would be seen as unhealthy, or I am sick, and this will impact on my visa. This will impact on my working, my capacity to provide my work in the best of its ability, and it may have its negative implication on future visa applications, for example. But this is not the concept here in Australia. Coming in is when you go in and register with your GP, you do your baseline test, or you do your baseline registration, and you enter yourself and your family, if you're coming with your family, into the what we call the public register here. They have a system where they can monitor you. So if you're due for a pap smear, they'll send you a letter. They'll find where you are. And they have so many networks here compared to Fiji, where we don't have that system. where they can remind you, you are due for your pap smear, please come in. Or, and it's a very good system. And this is the reason why they collect so much information. And we tirelessly say every day, why do we have to give this information over again? But it is for these reasons.
I think it's actually something, Dr. Tema, that Dr. T actually said in one of our previous discussions. Dr. T, you actually said you liked the idea that someone was out there thinking about you when you got that letter. And I thought that was a really interesting way of phrasing it, that it is actually true in Australia. If we're sending you a letter, it's because we're thinking about you, and we do want to make those checks. And what Dr. Tema is saying there is, I think, is very true. As a GP, we actually are trying to do preventative medicine. So we want to see you before we find the skin cancer and before we find the changes on the pap smear. And so absolutely doing almost like a well check before those things happen, I actually think would make someone coming into the country and getting all their checks done potentially more healthy and less likely to kind of come up on any of those checks that might impact their visa. So I think it's a lovely way to phrase it, and that what Dr. T said on our previous chats, it is a nice way to think about it, that really we're there thinking about our patients and trying to catch up with them.
Yeah. No, that's really good, Fabian. Just building on that. In the Pacific, it's also who you know, what you know, and you feel comfortable with the person that you're going to go and see. Sure. And I encourage people to come and see me, in my clinic, because of the network of the people that are around, just to make the women feel safe that they're coming to see me. Unfortunately, as much as I'd love the whole of the Pacific to come and see me, or my colleagues who are of Pacific Island background, the issue in Australia is, unlike Fiji, you can walk up to someone's clinic and go, hey, can you see me, please? And, give me some prescription for some medicine or this. But it doesn't work here. In Australia, you have to have a referral pathway. And so you can't rock up to anyone's clinic and knock on the door and be seen. There is a proper referral pathway, because that is the only way that the clinics sustain themselves. And remember, each of these visits, they are costly to the clinic, they're costly to the system, and the system has to run. And so because of this system that's been put in place, everyone has to follow the law here in Australia. And this is one of the ways of safeguarding medical practice, and just to make sure that transparency is there, just so that we also understand this, from our different perspectives.
Well said.
Yeah, Vinaka, thank you so much for that. And I think for women who are listening in, I know, coming into a new country, it can be, so overwhelming. And just know that there are support systems out there. You may feel alone. And of course, there's so many barriers that you'll be faced with. But just remember, there's someone out there who can help you. And that's why we're running this Talanoa session, so that you can be able to reach out to Dr. Tema or Dr. Fabian or to me, and I can be able to, press some buttons from this part of the world. Vinaka vakalevu, let's go to our next segment on looking at, I think Dr. Tema mentioned about private insurance and things like that. Let's look at Medicare versus private health. Maybe we can discuss, comparing public versus private. What's the difference?
Sure. The words in itself are very self-explanatory, public and private. So if I were to put, sorry, Fabian, I'm always comparing and contrasting between the two countries, so it's easier for the clients to understand.
Good way to do it. Yeah.
In terms of public, it's, for me, the way I perceive it from Fiji, it would be equivalent to the government, free. Public system, free. However, in Australia, although they call it free, I've come to realize that, there's a thing called Medicare. Medicare is meant to be free, what they also call bulk bill, but someone is paying. It's the taxpayers that's paying. They will work out within each system, whether it is the hospital, whether it's the GP practice, or where it is a combined shared practice, the ways of sustaining that particular practice or system. And if it falls, sometimes you do have to pay out of pocket for certain conditions or services that's provided. I'll give an example. Here in the regional part of Australia, in South Australia, where I'm based, the women come in, there's no such thing as bulk. There was a bulk bill practice, but that doesn't exist anymore. Everything is all Medicare, so patient or private. If a woman is pregnant, they will see either a GP or in either of these practices that's available. They either have to pay front up and claim their money back, or they see the doctor and then they get billed and their bill gets sent to them and they'll have to pay that bill. Now, if there are tests involved, for example, an ultrasound scan here is not funded. There's only a certain number of scans that's funded. And so unless they come in to see a specialist with us in the specialist clinics, and it is for an obstetrically specialist indicated reason, then it gets funded. So all the other scans, they'll have to pay. And a scan is not cheap. It's $250 per scan, and they in Australian, or $300 per scan. So if they get 3 scans, can you imagine that's almost $1,000? And you have to really think carefully if if you're wanting to have children, because it is expensive. It's a very expensive exercise. And unfortunately, it's they have to give us quality system, and this is one of the ways of sustaining a service for this particular part of the region. And in the bigger cities, it is free, it's funded. So you can access all these scanning devices or services without having to pay front up. But there are costs, and you need to find out what is the cost. If there are costs later, it will be sent to you. But if you are a citizen here or a permanent resident, the cost may not be as much compared to someone who is not. And so it is important to really equally navigate these processes right from the start, before any of these emergency scenarios occur. For example, sickness or any disability. Fabian, what's your thoughts on your side?
Yeah, I think I would say that's exactly true. Probably from my end, when we get to, say, if I have a woman that's pregnant and we've done that dating scan and those bloods, and the dating scan can be, 100, 150, 200 out of pocket, for which they get about half back. So already there's a cost of $50 to $100 in the first, couple of weeks. Usually the bloods are free. So if it's Medicare covered, the bloods are done for free. But then we often have the discussion, and it might be after a few other scans or tests, as to, do we go down the public hospital route, or do we then go down the private obstetric route, where we go and visit someone like Dr. Tema in the private world, or do we go and see someone like Dr. Tema or her team in a public hospital? And I guess that's the next discussion that I often have. I think the other thing to talk about in Australia is, in the public system and the private system, this is where it becomes more complex, because you actually have private midwife care and you have public midwife care. A midwife is a very well trained health professional that basically just looks after pregnancies, women, and their post-care and pre-care. And so in Australia, these practitioners are an integral part of the public hospitals, but there's a growing number of private midwives. And so it's confusing for us, isn't it, Tema, that there's so many options, let alone someone just come into the country and, or been here for years and is just trying to kind of work out the system. So I think there is public options, there's private options, but there's also different
lab options.
Correct.
So good. Yeah, interesting discussion. It's so complex, and that's why I totally agree. Even for the medical professions, it's all very complex. and let alone coming in, not
Mm.
understanding the system and starting from scratch or square one. So again, getting the right advice is really important.
Mm.
I think this is where I would advocate for GPs is finding a good GP or finding a good podcast, a good Facebook group, a good mothers group, a good Fijian group, a good Colombian group, whatever it might be, finding a good support network
Network,
and
yes.
finding out and leaning on that support network, because it is confusing, and hopefully that's what tonight helps with.
Thank you.
Oh, wonderful. Now, what about those who would like to have a combination of both, private and public? Can that work?
Yes, certainly. There's something called a shared care service that we offer, and it depends again on who you go to and what you go to, and let's be very clear with this. The message to the public is, you have the choice to pull out of whatever you have been offered, you have engaged with at any time during your pregnancy, in your intrapartum care or your postpartum care, or in your gynecological care, or even if you're for your GP engagement for any other reason. So say, for example, if you turn up for your first antenatal package, you go to your first GP, you see, say, someone who you're not happy about with the care that you were given, and you feel you weren't heard or things didn't go right. You still have the choice to go and find another practice. And say, for example, you go to Fabian's practice and you get your care and you're happy with your care. And Fabian recommends, okay, you're from here. We've picked up X, Y, and Z number of problems, and so you will need to be seen by a specialist. Your option is you can go to a specialist in a public system, as he said, or you can go and see a specialist in a private system. These are your options. And you can choose to go in Australia, you can choose to go to see any specialist in any state, wherever you want. It's up to you. And it doesn't mean you can stay in Queensland. You can go to Brisbane, you can go to Sydney, you can go to Melbourne, wherever. But there is a process, there's a referral process. But at the end of the day, it is best to be consistent with where you are, because medical records is really also hard to chase. And the systems are a little bit different interstate. And so we encourage women, if you feel you're safe in one state, try and stay there for the rest of your pregnancy, and also leading up right to your delivery, because it is easier for that particular state to go through all of your antenatal care as well as your delivery care while you are there. And, if you don't have access to what are the GP providers that's there. The other option that I also encourage our women is, there are referral pathways, and there's also a feedback system where you can go into Google reviews and review GPs that are available, for example, or Google reviews of your local specialist providers, and see which ones are better. Everyone will be different. Everyone will have a different form of practice. In Australia, the private and the public system are all encouraged. It's very different to New Zealand, where it's separate. Here it's integrated somehow. That makes it a little bit confusing, but it is an enabling thing because women get the choice at the end of the day. It's all about patient customer service provision.
Thank you so much. I was just thinking of one experience I had because as some of you may know, we moved countries quite a bit, and we moved from New Zealand to Australia. So we lived there for about 2.5 years, and then I remember there was a referral that I supposed to have, and they were looking for me. And coming back to Dr. Fabian's point, it was so lovely when I returned to New Zealand. The system picked up that I'm back in the country, and I had a phone call and an email. And I remember when I visited the doctor said to me, "We were looking for you." I was like, oh, I feel so special.
You miss me.
Yeah, and I'm just so thankful, when we have systems like in Australia and New Zealand, and I'm just so grateful, coming back to the point that, I mentioned earlier that Fabian remembered, when you get that letter, it feels like, someone remembered you, someone was thinking about you. So to our women out there, don't feel that don't feel scared. And again, being scared or being overwhelmed can also lead to procrastination. And you can just keep telling yourself, I'll go next week. I'll go next week. And many of us in the islands, that's what we do. It's normal. I'll go next week. Especially for women, right? When your children get sick, we run with your children to the hospital. Or when a husband is sick, everybody drops everything and let's go. But when it's about us, we leave it to the very last option. And please, that is why, again, we're doing this session here. So for segment number 3, we're going to be looking at, some of the questions that we women can ask. And again, coming back to the point of, what should I ask? I'm so scared and all of that. Remember, we have our 2 colleagues here who can help us. Now, if a woman has private health insurance, Dr. Fabian, Dr. Tema, what are some questions that they can ask? If you can help us with that.
Fabian, do you want to answer this?
Yeah, of course. So if they do have private insurance, did you say, Dr. T?
Yes,
Yeah.
private health insurance provider.
If they have private health insurance, then this is still the same avenues that Dr. Tema and I have explained. They still can choose the public option, which in a lot of big cities may actually be the biggest hospital and the largest care provider there. And so even though they have paid for the private insurance, they may still prefer to have that public hospital cover. What it also means, though, is that they are eligible, or they can put funding towards having someone like a private obstetrician for their pregnancy. I think some things that a patient should be asking about with their private health is, what does it actually cover? So we're talking about not hidden fees, but costs and bills that might come after. I think it's really good to go back to that provider and actually find out how much of that care and what parts of the care are covered. Are all my bloods covered? Are all my vaccines covered that we now are doing a lot in pregnancy? Are all my scans covered? Is my baby covered when it comes? And then where, I think probably another part of this talk is, once I have my baby, are they on Medicare? Are they on private insurance? And I mean, that's a talk in itself. But basically, there is some very good information when mothers give birth about how to apply for Medicare for those babies as well. So I think having private healthcare just gives us more options, but those mothers can still choose our large public options as well as the private.
Vinaka, Dr. Fabian, and the other question I want to ask is, what about those without the private health insurance?
So I think this is where we go back to, we do in Australia have a good backbone with where we can get free healthcare. And although the waiting lists might be longer in some scenarios, we do have bulk bill GPs that, again, we could use Google or we could ask friends. We do have public hospitals, and I think we should always go back to the, what if I'm really stuck? Where do I go if I can't go anywhere? We do have emergency departments and urgent care clinics where you can show up, and you may not be sick, but you may be pregnant and you may not know where to go next. You can be seen absolutely for free in these ED departments and urgent care clinics, although it's probably not the best place to be, or the most helpful place to be for early pregnancy, I think we should tell our women listening that we can get help that way as well. And often in those ED departments, there's people like social workers and nurses and other doctors that can then redirect those mums and families that may need those bulk billed GPs or the public health system or other high quality maternity services. So I think as a safety net, as a just in case, anyone can turn up in our Australian EDs, emergency departments and urgent care clinics.
I totally agree with you on that one, Fabian, because, there's no doctor and no healthcare system here in Australia that will turn a woman away if they turn up for any medical reason. And that is, we are governed by our own oaths and principles. And that is one of the things that we do serve is the public and the interests of the best interests of the public. So if you are unsure, it's okay. You can turn up to your GP, you can turn up to your own provider and be seen and ask for help, even if you are uncertain.
And I think we would encourage that. I would love for someone that doesn't know where to turn to come to me and just ask that simple question. I think that's probably, I could provide the most help for that person. The person that is absolutely lost, is absolutely terrified, it doesn't know which way to go. That's where we should be helping these people. And I hope in Australia our colleagues would do that. And I think I can speak for most of our colleagues to say that they would. So please show up, see us anywhere you can.
Vinaka, vakalevu, that's so reassuring. And, and I'm just reading through some of the comments of our women who are listening in, Vinaka vakalevu to both of you. Now, to the second last part of our Talanote today, we're looking at some of the misunderstanding and also common myths out there in the community. Would you both clear up some common misconceptions in the community about health?
Vinaka, Dr. T. So I'll open up by talking about the concept of private insurance, particularly those who arrive into Australia for the first time. Do I need private insurance to give birth? The answer is no. If you do have Medicare, for example, you can give birth anywhere. You can give birth in a public hospital, which has equally an exceptional service comparative to the private system here. There's different services they provide, and they will go through that with you, usually in detail. But the answer to if you do you need a private insurance to give birth? No. But if you do have a private insurance, it's an added bonus, and you do have the choice of either accessing both public or private.
I think one of the other things that I often hear, Tema, is if I go to an ED, so an emergency department, or an ER, sometimes people refer to it, I'll be charged a lot. And again, I think we could make that clear that if we have our Medicare card and if we're Medicare eligible, emergency care is free in Australia in a public hospital under Medicare. So again, as I said, as a last resort, if we're worried, we can go to ED and it will be absolutely free with Medicare.
That's so true. Thank you, Fabian. And the same goes for Pap smear. Pap smear, do you need Pap smear? Do I have to pay to go and get a Pap smear done? It is free here if you do have a Medicare card as well. And and additionally, if you do have a private insurance, you can choose to have your Pap smear done at anywhere that has the ability to do private or public Pap smear. But it is universally accessible. There's also drives in the community on providing free Pap smear screening programs, particularly in mobile trucks or these community groups that's performing it. And that's something also that you can tap into if that is something that you are looking at in terms of your Pap smear program.
Vinaka, vakalevu to both of you. And now looking at some tips that you could share for our women who are listening in today. What are your top tips to make our Pacifica women, feel more empowered about their healthcare here in Australia?
I think from my point of view as a GP, I think find a good network around you. And the power of the internet these days, I think, is fantastic. Go and find out who your local doctor might be that other people are talking about, are on good mothers' websites, or on good family websites, or are rated well. And if you don't have access to that, that's fine. I would like you to turn up and try and register with one of your local GPs and see that, like, try that relationship out. Like Dr. Tema said and Dr. T, if they're not right for you, you're not locked into that doctor. We want the right doctor for you, so that if things happen in the future, you trust them and they trust you, and then they can refer things on if they need to and have those chats. So please come and see your local healthcare person. Show up to the public hospital if you need to, but don't be afraid to come and see us as doctors and ask these questions. And you use that community around us that I think is really these days is easy online. I think we can, as we're showing tonight, we're drawing resources from around the world really tonight. And it is as easy as popping on a computer or on your phone and looking to see what supports and what help is around you. So yeah, come and ask the questions, build a relationship with your doctor, and it's hopefully it's not as scary as you might think.
Thank you, Fabian. For those who may or may not already know, there is a group in Australia. It's called the Oceania Pacific Health Association Group. And the group in itself is an umbrella that advocates or speaks for women or Pacifica people of different age groups, different gender, and of very specific island backgrounds. And in the group in itself, there are Pacific Island healthcare providers that's available. One thing I know for sure is that in Brisbane, there is a Pacific Island primary healthcare service that's just been set up by Dr. Letty Cheng and Michael Cheng in Logan in Brisbane, we also have our Australian-based GP providers, people like Fabian, for example, who have special interest in our Pacific Island people, and particularly Fiji. So these are all the different networks that we can tap into if you are looking for people that you want to go and see within the area. And I also am using this platform to advocate and also challenge our other healthcare providers that's listening in. If you wish to have, your service being known, or to make the public aware that you exist and that you have this service in your own communities across Australia, please feel free to get in touch with us, and we can be the network to the public and provide this information that the public needs so they can have access to healthcare that is available to them.
Wow, that's wonderful. And if I can just share quickly an experience I had in Hawaii, where one of the points you shared in a prep for this Talanoa, Dr. Tema, was learning about your rights and requesting a female doctor. If you are feeling uncomfortable. And I remembered in one of the medical center we had in Hawaii, that was provided. They even ask you when you come into the front part of the medical center if you prefer a female doctor or a male doctor. And if there's a male doctor that is actually working at that particular time, they will bring in a nurse. Yes, a nurse to be with you in the room. To me personally, when I experienced that, it was wonderful. It just gave me that, calm feeling that, I wasn't really nervous, but there was another extra person there. So there you go. Yeah, so just giving those tips and ask. So don't be shy. Dr. Fabian?
It's any time that I'll examine a woman, I'll always ask for a female nurse to be in the room, and I think it's a very good point. We want to really protect our female patients and make them feel comfortable as a male. And then if they're not comfortable to see a male, I think the point you raise is asking for a female doctor that you feel comfortable with. I think is a great point.
That's so true. Just some other tips, for navigating healthcare for our listeners out there. Ask questions and don't be afraid to ask. If you are preparing yourself the day before to go and see a doctor, so it's always, and ask culturally. Sometimes the cultural taboo does come in. Just the concept or the fright of being able to walk up into a healthcare system or the hospital. If that is something that you find hard to navigate, perhaps a suggestion of writing down some notes of everything that you would like to be answered before you go and see your doctor the next day or your healthcare provider. Write it down the day before or the night before. Sleep on it. In the next morning, write some more, add some more. Bring your notes. And often, always, when we sit with our patients, I get them to open their notes and we discuss everything. And said, oh, yeah, what is bothering you? Let's talk about it. It's okay. Don't be afraid and speak up, and we can go through your plans together. And Fabian will talk to you about care plans. Here, it's all about the patient. It's not about what the doctor thinks. It's about the patient. We are strong advocates for that. And I will speak for my practice. If a woman comes to clinic and she's afraid of all of these things being looked at, I give her all the options from non-medical to medical to surgical options. And once she is given all that information, sometimes I even let her go home with that information, provide some written resources so she can go and read about it. I also offer her the support of various people that she can talk to, and then call her back in a week or 2 weeks time or a month's time when she's ready, and we rediscuss the options again. And once she's ready to make a decision, and then we make a decision, particularly when it comes to surgery, because as a surgeon, that's one of the biggest fear of what's going to happen to me if I undergo anesthesia. Will I make it out alive or not? All of these fears, it's constantly a boiling point. So at the end of the day, do not rush with your decision making. Speak up, write down notes. If you need an interpreter, bring an interpreter, ask for interpreter. If you need a support person, bring a support person. If you need to ask more questions and then come back to your doctor, it's okay. You can always make another appointment and then come back. But learn to speak up and also understand your rights here in Australia.
Can I add one thing there? And I think we've probably touched on it a little bit with health records. Is in Australia there's something called My Health Record, and what it actually is, it's a central hub of your health, basically like a health summary. That if I saw a patient here in Queensland and then they went over to South Australia and needed to see Dr. Tema in the hospital, and they were on my health record, both myself and Dr. Tema would be able to see the same note from that patient sitting on their my health record. So I would ask that people look and our women.
Okay, all right. Vinaka vakalevu, Dr. Fabian, I think we lost a little bit of what you said towards the end, but I think we got majority of what you're saying earlier. Would you like to say just the last few, maybe the last sentence you said before?
Sure. I think that my health record is really helpful, and you have to you can opt into it. So I think for all of our women that are looking and would like their confidential records held in a secure place that healthcare professionals can look at, they can look at my health record, and I think it's very helpful.
There you go. There you go, ladies. Thank you so much, Dr. Fabian, for sharing that. So, yeah, my health record. And again, it's the choice you have to make on where it should be kept. So that's wonderful. And I think having the record, just kind of, it can be tracked, it can remind you the next time you're going in to have all the information and all the checks that you had prior. So Vinaka vakalevu, Dr. Tem and Dr. Fabian. Now, remember I said we were going to speak for 30 minutes, and obviously we've gone way over and above that, but I'm having fun, just hearing all these wonderful things that you both have been sharing, and also the comments from our viewers, which is really great. Now we're coming to the end of our Talano session. What any of your final advice to our women? We'll start with you, Dr. Tema. Ladies first, and then Dr. Fabian will summarize. Vinaka.
Vinaka, Dr. T, thank you to all the listeners for joining us today. My final advice is healthcare is your right here in Australia. Use it. Speak up for yourself. And if you're not sure about anything, always ask. Whether you're here visiting on a permanent visa, you're on a resident visa, or even if you're a citizen, it doesn't matter. Speak up. Your healthcare is your right. Don't delay your care and always ask for help. And anything that is related to women's health, please don't hesitate to go in and find the right healthcare provider. Always ensure that you bring in your support person and your interpreter if you do not feel uncomfortable speaking in English. But there's lots of provider services here in Australia. We have our Itauke language provider as well that's available in most healthcare systems, so you can ask for a Fijian interpreter. Nakapakalevu.
Naka, Dr. Tema and Dr. Fabian.
I'd just like to thank Dr. Tema and Dr. T for tonight. I think it's, as always, it's a real honor to be part of something like this. And all I do is say the same as Dr. Tema, is we're here to serve you, not the other way around. So as doctors, we want to do the best by all our patients from wherever you may be in Australia or overseas. We want to see you, we want to help you, and we want to take the time with you. So although it might be busy and rushed, and you might feel a little bit of fear maybe coming in, or unknown coming into the doctor, I think that there's been a lot of really good points tonight. Dr. Tema said, write it down, make a list. I think that's a fantastic idea. Come in with questions. If you don't like the person, if you don't feel that relationship and connection with the doctor or the health professional you're seeing, we can find you someone else, and you can go and find someone else. So we're here for you. We'd like you to reach out, and we'd like to see you sooner than later. We don't want to see you when things might be harder to deal with. So come and see us early. Have a great night. Thanks for staying and listening, everyone.
Vinaka,
Wow, Vinaka vakalevu. So to our dear listeners, if you found today's video helpful, please share it with your family and friends. And remember, your health matters, and you deserve the best care Australia can offer. Hey, Vinaka vakalevu for joining us on Let's Talk Women's Health today. Until next time, stay well, stay informed, and you all take care. Vinaka vakalevu.
Naka.
Naka Vadamanda, Vinaka Dr. Fabian, Vinaka Dr. Tema.
Bye, Dr. T. Thanks, Dr. Tema.
Naka Made. Wow. There you go, ladies and gentlemen. What a wonderful session we've just had with Dr. Fabian and Dr. Tema. It's one of our mission, to share this medical information and health-related information to our women out there. Even though we initially wanted our Talano session today to be focused on Fijian women, but then we realized that we also have a lot of our Pacifica women and other women from other cultures that listen into my podcast, and we wanted to spread the love and incorporate everybody in this Talano session, particularly for those of you who have moved over to Australia, or who are long-term residents of Australia, or citizens of Australia. And it's wonderful that, we've been inviting our medical doctors, to come on this program and to, share many of this information that may not be easily accessible to everybody. So please share this video. And also, if you're thinking of, other medical questions or topics that you would like us to talk about, please inbox me, send me a message. Dr. Tema and I, we speak every other day. We'll be happy to put a program together. Now, this session today is in English, and this coming Sunday, we will have a Fijian speaking session. So Dr. Nani Sesikiti, Dr. Tem and I will be talking about women's health, but in the Fijian vernacular. So yeah, Vinaka vakalevu everybody for taking the time out from your busy schedule to sit in and listen to the three of us. And we hope that what we've shared today was very important to you and can, encourage you to take some action and, do something about your health, or checking your visa, checking your insurance, or checking that Medicare. Whatever action you're going to take, we wish you all the very best. You all take care, and a very good evening from me.